seeing this video by accident. You need some help with your NCLEX. I'm here to help you. Do not click that skip button. Listen, we're gonna solve a question, we're gonna discuss the rationale, and then I'm gonna explain to you a little bit about thyroid. Alright, thyroid, hyperthyroidism, hypothyroidism, surgeries, different topics, similar topics to what I discuss on my webinars, so bear with me. I'm gonna give you great tips of smart NCLEX taking strategies and smart test taking skills, so bear with me. We're gonna read this question together. This is a very common question that you see on your NCLEX. So, what is the most important assessment for a patient post-thyroidectomy? Flaccid muscles, numbness and tingling in the fingers and toes, leg pain, or confusion? When you get that question, you can pause it right now and pick up an answer, but the right answer is number 2. Numbness and tingling in the fingers and toes. And you're gonna ask why? Because after a thyroidectomy, there is a high chance that the surgeon will remove the parathyroids as well. It is a gland that sits on your trachea. This is the front side, and the rear view looks like this. You've got 4 parathyroids that sit right there. So if you're doing a total thyroidectomy, there's a high risk that you're gonna take those parathyroids, right? And one complication when you take the parathyroids out is hypocalcemia. So when you're having hypocalcemia, one of the signs and symptoms are numbness and tingling around the mouth, the hands, and the toes, as well as muscle twitching. So that's a very common complication. When you take the parathyroids out, you get hypoglycemia. Now, let's talk a little bit about the thyroid. Thyroid, the main function of the thyroid is to regulate your metabolism. There are 2 diseases that are acquainted with the thyroid: hyperthyroidism and hypothyroidism. We're gonna talk about both real quick, but every one of them has its signs and symptoms, its treatments, so we're gonna go briefly around those. I know you're busy, I don't want to take much of your time, but this will really help you towards your NCLEX. Just be smart about it. There are things that you need to know for your NCLEX, and there are stuff that you do not need to know. That's why a lot of nurses get confused. When you're studying for your NCLEX, you're gonna go study those textbooks. Some resources in the market like Kaplan, Remar, this and that give you shit that you do not need, trust me. So we're gonna start with hyperthyroidism. The most common form of hyperthyroidism is Graves' disease. So what's the treatment for hyperthyroidism? Alright, there are 3 treatments. The first one is radioactive iodine. Bear in mind, when you're giving radioactive iodine to a patient, it is excreted in the urine, and it takes 1 week. It stays in the urine, the half-life is 1 week, so make sure that you stay away from pregnant women, and you stay away from women who are lactating. That's very important. The second line of treatment is PTU, and don't freaking ask me what PTU is. Just Google it. If I have it in front of me, I can pronounce it. If I don't, I cannot pronounce it. ETU is an anti-thyroid hormone, and the things that you need to monitor is white blood cell count, in specific neutrophils. You're gonna watch for that neutropenia because your patients will start getting fever and infections here and there. So make sure you watch out for that white count and your neutrophil count. Alright, the third treatment for hyperthyroidism is thyroidectomy. It's a surgical procedure. You take out the thyroid. There are 2 forms of surgeries. There's total thyroidectomy, and it comes with certain consequences, and there's partial thyroidectomy, or they call it subtotal thyroidectomy. So with total thyroidectomy, you're gonna take lifelong thyroid hormone therapy, hormone replacement. Alright, usually it comes in the form of levothyroxine. That's the most common form. It's a pill. You pop it at 6 a.m. every morning. The second thing you need to know about total thyroidectomy is that it is very hard to save those parathyroids that are sitting on the back. It is very hard. Now, subtotal thyroidectomy, no need for lifelong hormone therapy, right? Because you're reserving part of the thyroid, but you will face something very lethal, and it's called a thyroid storm. And now you're gonna ask me, Mo, what is a thyroid storm? A thyroid storm is overactivity of the thyroid gland, and you're gonna have a rush of thyroid hormones all into the patient's blood, and that patient is gonna have something called a thyroid storm. Thyroid storm has signs and symptoms of fever, more than 40 degrees, higher than 104 degrees Fahrenheit. It's crazy. Sometimes you need to dip that patient in ice just to control that temperature and keep it down. Another complication or sign and symptom that you're gonna face with a thyroid storm is high blood pressure and high heart rate. Usually we say blood pressure and heart rate more than 200, which is 200 beats per minute, or 200, the systolic blood pressure is above 200. It is crazy. And the patient-nurse ratio for these kind of patients when they are facing a thyroid storm is 2-to-1. And I don't mean 2 patients to 1 nurse. I mean 2 nurses for 1 patient, because this is very critical. It is a very critical situation, and you need 2 nurses to keep an eye on that patient. So treatment, there are 2 things you need to do. You need to control that temperature, and you need to give oxygen to the patient, usually 8 to 10 liters of high flow. Now we're gonna switch into complications. Complications post-op. There are time frames for complications. First 12 hours after a thyroidectomy, and then 12 to 24 hours after a thyroidectomy. And depending on those time frames, there are signs that you need to look for. For the first 12 hours post-op, for this question, it didn't mention anything about post-op, like it didn't mention the time. If here it says for a patient, 8 hours post-op, then I would know what are the signs and symptoms that I need to look for. But since it did not mention, and these are pretty clear, if you look them up, now we're gonna talk about it, you will pick up number 2 very quickly, all right? So the first 12 hours, the 2 things you are looking for is airway and hemorrhage. And they are both at the same importance. Airway, because post-op you're gonna have inflammation and edema around the trach, so you need to keep an eye on that airway. All right, hemorrhage. Usually there are 2 words and people get confused with it, especially on your NCLEX. When we say bleeding, it means something visible, like I'm bleeding from my arm. I have a cut and I'm bleeding from my arm. I had a head trauma, there's an intracranial bleeding, it's called hemorrhage. So hemorrhage is way more critical than bleeding. Bleeding is from the outside, you press on it and then you solve the problem. But hemorrhage, oh my God, it is internal and you need a surgical operation most of the time, sometimes just monitoring. All right, 12 to 48 hours post-op or post-thyroidectomy, what are the things you need to keep an eye on? There are 2 things, it depends on the surgery. So if you're doing total thyroidectomy, you need to keep an eye on tetany. And medical terminology is very important on your NCLEX. That's the first thing I focus on my webinar. And by the way, by the end of this, I'm gonna talk a little bit about my webinar for you guys who are interested, who like the education style, and who like the information. I'm gonna talk a little bit about my webinar. But total thyroidectomy, you need to keep an eye on tetany. Tetany, which is the twitching of muscles, that numbness, that tingling. But if the patient had a partial or subtotal thyroidectomy and it is 12 to 48 hours post-op, then the things you need to keep an eye on is the thyroid storm. It's freaking crazy. Yes, I know. There's one more thing I'm gonna talk about, which is hypothyroidism. So we said there's hyperthyroidism, that's Graves' disease, and hypothyroidism. All right, what are the signs and symptoms of hypothyroidism? Obesity, down personality, heat tolerance, cold intolerance, bradycardia, hypotension, myxedema. And you're gonna ask me, Mo, what is myxedema? Hey, listen, when you attend my webinar, with every medical terminology, with every sign and symptom, if it is difficult, then you're gonna see a picture, you're gonna see a chart, you're gonna see something that you can relate to. And that recall of image memory is very important on my webinar. So when you're sitting for your NCLEX and you're solving that real test and you come across a question that's talking about hypothyroidism, and then you see the word myxedema, instantly you're gonna remember that picture, you're gonna remember that slide, and that's very important. All right, now what is the treatment of hypothyroidism? It's not rocket science. You have a hypothyroid, low hormones. You're gonna give hormone to the patient, right? The best form of thyroid hormone is levothyroxine. It's very popular in hospitals. Usually it is given at 6 a.m. But you need to keep in mind, and I always say, do not pass the bucket. If you have a question that has multiple choices and one of those choices is call the provider, keep that to last, all right? Usually it's wrong, but don't cross it, just keep it to last, because I hate to pass the bucket. There's always something that the nurse can do before passing the bucket to a provider, nurse practitioner, whatever the case might be. So in this case, if in the morning the patient has a surgery and he's NPO, do not hold that levothyroxine. You need to call your physician. That's the time when you call your provider, call your physician and ask him, do you want me to hold that levothyroxine? 9 out of 10 times he's gonna say no. Give it to the patient because you're gonna fuck him up during surgery, all right? And then last but not least, risk for myxedema coma if the patient is sedated. And where is that important? It is very important to take the past medical history when the patient is going to the ER. So if you're having a question and the question is saying about a patient has a past medical history of hypothyroidism and he is on levothyroxine, and the patient went to the ER for a car accident, you need to be aware because those patients, you cannot sedate them heavily because they will go into something called myxedema coma. You're gonna tell me, Mo, are you gonna explain to me myxedema coma? No, I'm not, because I discussed all that on my webinar, and now you're watching an ad. It's very brief. I don't want to take long of your time, but if you want to know more, you click that link down there, and you're going to go to a site where you're going to learn everything about my webinar. And if you need to contact me, give me a call, WhatsApp, send me an email, you can do that right there, because you will have all my contact information. All right, one last thing we're going to discuss are, what are the signs of hypothyroidism? And this is a very important question that comes on every NCLEX test. There are two signs that you need to pay attention for: spastic signs, intrusive signs. All right, these are medical terminology. It is very important to know them. Spastic sign, it is hyperexcitability of that facial nerve. So as soon as you touch the cheek, that cheek will start twitching. It's called tetany. Intrusive sign, it is a carpal spasm. Usually if you tie a tourniquet around the arm, or if you have a blood pressure cuff and you squeeze it, then you will have a carpal spasm. And that is an indication that this patient is hypocalcemic. He's low on calcium. To solve those, you just need to give calcium to the patient. Alright, if you like this mini presentation and you want to see more, my name is Mohammed. I teach NCLEX for those who need help just like you. For those who failed NCLEX before, I always get emails from people who are devastated, who are down, who are in pain, who feel they are unworthy, have low self-esteem after they failed their NCLEX, and I tell every single one of them, you've came to the right place, because I know what I'm talking about, and I can make shit happen for you. You will pass your freaking NCLEX on your very next attempt. So if you haven't clicked that link yet, it could be here on the screen or down in the description box. Go click it. Let me help you. Let me teach you more about the NCLEX, NCLEX strategies, NCLEX content, smart test taking skills, all that in one package. My webinar is crazy. It has shown 99.9% success rate. You're gonna freaking love it. If you want testimonials, you just go to my website, or you hit me up on the WhatsApp and I'll send you testimonials all day long. And if you go check my website, go to my webinar and check the reviews on the website, and you're gonna freaking love it. Alright, for now, that's all. If you want more, you need to subscribe to my channel. And if you need help with your NCLEX, go click that link, because I can guarantee that you're gonna freaking pass on your very next attempt. This is your boy Mohammed, and until next time, be an alpha slice.
I did run out of